About 20 after 9, a police officer showed up at our door and said that, there had been an accident and that Aubrey was taking priority 1 to Johns Hopkins Bayview. She was burned 30% of her body from her arms, chest, neck, face. So we knew at that time that it was bad.
Our burn unit patients come from all over the state to Baltimore for some of the best care in the world. But not only do we have sick patients in the burn unit, we have sick patients throughout our hospital. And so our focus on patient safety is critical across the medical center. Johns Hopkins Bayview traces its history back to before the Revolutionary War. We were founded in 1773 to help the sick in Baltimore. In the middle of the 20th century, Peter Saffer began one of the first multidisciplinary ICUs, perhaps the first multidisciplinary ICU in the United States. We've built upon that legacy over the succeeding decades with the first kidney transplant in Maryland, one of some of the earliest bone marrow transplants in the country. We're very proud of this history, but we're looking to the future, and we're trying to make sure that our care becomes safer and safer.
All of our initiatives, the major initiatives of patient safety, of service excellence, of diversity and inclusion, and employee engagement, all roll together. They are all interrelated and can impact patient safety.
Safety is the background, the platform, and the framework for everything that we do in healthcare. And it's important to frame it from a patient perspective, but also in the environment in which we practice and those who deliver the care.
We recognize that we need to have engaged employees who feel part of teams to take the best care of our patients. We focused increasingly on this culture of collaboration.
Patient safety turns out to be a team sport, not an individual activity. And the only way you get teams to work together is when they respect each other and listen to each other.
It allows us to transfer information that's so vital.
We have executive patient safety rounds. Staff will be able to come into the forum and discuss events or concerns that they have. We have the advantage of having an executive in the room, and their role is to eliminate barriers or be able to provide resources in order to make changes in patient care.
We have always had a very paternalistic approach in medicine where we know what's best. Dr. Hellman has brought the Aliki initiative here, which is a different mindset. It's partnering with the patients to have them take an active role in their health care.
The essence of the Aliki initiative is to imbue in everyone the importance of knowing their patients as people. And when you know someone as a person, and the Aliki initiative really facilitates this, it allows our residents to go visit their patients in their homes, then you have a much better idea of how they're functioning. And in this exchange, you develop the capacity to both listen and communicate.
Over the last decade, there's been an increasing focus on the technology of taking care of our patients. We've installed new IV pumps. We've brought new equipment to our operating rooms and to our imaging suites.
We have opened a very technically advanced dual operating room that provides a significant improvement in the accuracy of our operations, but also an immediate verification of a lot of things that we do during the operation before the patient leaves the operating rooms. And this is done through the placement of a CT scan in between the two rooms.
Patient safety has improved. When I started nursing, there wasn't simulation at all. We didn't have simulators. Now we're able to use the technology of a simulator that has a computer system attached to it, so we're able to practice high-risk scenarios on a mannequin as opposed to an actual patient, and then we can learn from that and improve systems and improve our technical skills so that when we take care of patients, we do it in a safer way.
Technology is extremely important in what we do and helping us provide very safe care, but our employees are our backbone.
So the innovative spirit at Bayview is one of our greatest strengths in improving safety. And our faculty, nurses, and staff have come up with novel ways of improving safety.
We have pyramid grants on the units, and these are grants from Dr. Hellman, our Vice Dean of Medicine. And these are ideas generated from staff to make sure that the patient experience is a great one and also that patients feel safe.
One of the simplest examples of how we're improving patient safety has been our focus on hand washing. We've established what I believe is one of the most rigorous definitions for hand washing, which means that every person that walks into a room uses a gel just before they walk into the room and gels when they walk out of the room. And using secret observers, we're seeing that we're being compliant with those definitions more than 90% of the time.
If we don't ask about safety concerns, we really don't know about it. One of the processes that we have is our patient safety net. It is a database and staff is able to enter events online. Then what happens, our patient safety department every day reviews the patient safety events that have been submitted. Based on the event, we appropriately either refer out or follow up to see if we need to make some system-wide changes. That staff who enter the events actually get some feedback that, yes, it made a difference.
Johns Hopkins Bayview has unique assets it can bring to patient safety. Number one, we care. And secondly, we have fabulous people.
As we look to the future, I'm very optimistic about our ability to make patient care at Bayview even safer. At Johns Hopkins Bayview, we have all the tools we need to become a leader in patient safety.
Last year I was diagnosed with leukemia, and when I was in the hospital, it became very apparent to me how vulnerable I was. I mean, I always had an appreciation of how vulnerable patients were, but until you've lived through it, you never really appreciate that.